Good morning, Los Angeles, and welcome back to Fire Station 4, where some of you saw us yesterday announcing a great city-county partnership on mental health, 24/7 response, a non-police response to mental health through 911. And I want to thank again Catherine Barger, the Board of Supervisors, my colleagues on the City Council, and the Los Angeles Fire Department who hosted us. We're back at the same station for another reason today, to share more exciting news with folks here in Los Angeles in what has been such a painful year. And I'll come back to get my remarks, but I want to introduce first my partner in all the things we've been doing this year. I mentioned yesterday the city of Los Angeles has never been closer to the county of Los Angeles than this year. That was born out of necessity, but it was also born out of a deep respect and a strong friendship that exists between those of us that represent the city of Los Angeles and those elected representatives that represent you for the county of Los Angeles. And that's been led by the chairwoman of our Board of Supervisors, who every week, if not every day, we're talking to see the ways that we can combat COVID-19 together. And that's what today's news is about, an exciting pilot that will help us hopefully get even more progress in our activities to save lives and save livelihoods. But first, let me toss it over to your chair of the County Board of Supervisors and my friend, Catherine Barger.
Thank you, Mayor Garcetti. I have to say, 7 months ago when we began working together, I never imagined that it would be 7 months. But it has been 7 months of collaboration both with the City of LA, City of Pasadena, and the City of Long Beach. We've come a long way, and I give Mayor Garcetti and the City of Los Angeles a lot of credit as it relates to the testing. They were first in line to work with the county to get rapid testing up and running throughout the entire county. So I have a debt of gratitude on behalf of the residents of Los Angeles County. Throughout this process, we've shown incredible leadership working together and identifying and researching innovative solutions to help our communities. The rapid antigen tests that are being announced today is one of those critical initiatives. Bringing these tests to Los Angeles required not only collaboration with the County Department of Public Health and researchers at the University of Southern California, but also with local and state leaders across the nation who are also eager to pursue technology. From the start of the COVID-19 pandemic, access to cost-effective and efficient tests have been a priority for Los Angeles County, and today you are going to hear about the success moving in that direction. We have consistently adapted to seek a more cheaper and accurate options so that we can expand access to testing and provide results in real time, especially when we focus on getting our children back to school. The objective of mass testing was not only to track how the virus was spreading through the communities, but also to allow our residents to safely return to work and to school. The rapid testing plays a key part in that it will be allowing individuals to frequently test and identify when they are at risk of spreading the virus. Currently, we are seeing many COVID-19 positive individuals are not tested until late in their symptomatic cycle. With this new test, our hope is that positive cases will be identified early and reduce the risk of unknown transmission. And through this pilot program being launched, we can help our first responders work safely. The second phase of this trial will be a crucial factor in helping children and teachers return safely to the classrooms. Our goal remains drastically to reduce the spread of COVID-19 in our communities while minimizing social and economic impacts to our children, families, and workers. Rapid testing aligns directly with this goal. I am looking forward to the coming stages of this program and other initiatives that will similarly help us move forward. And with that, again, I would like to thank you, Mayor Garcetti and the City of Los Angeles, as well as your incredible Fire Chief, Chief Terrazas. And with that, thank you.
Thank you. I'm the designated sprayer, too. All right. Thank you so much, Supervisor. And thank you again for your powerful leadership in the most pressing and the most difficult of times. You have really been a light in this county. I also want to thank the folks that Catherine Barger mentioned, our host and Los Angeles Fire Department Fire Chief Ralph Terrazas. I know how busy he has been in the last 24 hours and the support that we're giving to the fire that we see down in Irvine, and what a tough season this has been already for an extraordinary fire department. I also want to thank Dr. Neeraj Sood, who I'm going to introduce when I finish my remarks. He's the Vice Dean for Research at USC's Price School of Public Policy and has been a critical partner in so much of the work we've done as we've learned about testing and expanded testing here in Los Angeles County. And Dr. Paul Simon, who is part of the original band here, the Chief Science Officer of Los Angeles County Department of Public Health, who the county helped detail to the city so that we could back and forth work in the early days on testing and research, and has really been extraordinary. And I want to thank him for his great work. I also want to thank the Rockefeller Foundation that's funding this important research. I want to thank as well the Department of Health and Human Services of the United States. Catherine Barger and I met with the Surgeon General of the United States of America, asked for some of these tests, and we were able to procure some of them through our federal government as well. So today, boiled down, is about making sure we can test people more quickly in a way that will allow us to be able to develop protocols to hopefully put even more people back to work, back into schools, and to keep our recovery path moving forward. Launching this rapid antigen testing pilot is a remarkable milestone. It came from actually an op-ed piece that was written by Michael Mina, professor at Harvard, who I then picked up the phone and cold called and talked to him about the companies that were developing these tests that would be able to catch people's infectiousness in the bell curve in the most infectious period for a cheaper price and with a faster result than the PCR tests that we're currently using. PCR tests are very accurate, but they also provide information before people are infectious and long after they're infectious, and come at a much higher price. When we saw the pinches in the supply of PCR tests, we also saw, luckily not here thanks to our great partnership with Curative, but we saw 7, 8, 10-day waits, which made those tests irrelevant to stopping the spread. So it should come to no surprise to folks that here in Los Angeles, we're again leading the way. The first city to mandate masks, the first city to have widespread testing, the first city to have widespread testing for asymptomatic people that has caught 30% of the cases we've had, the first city to reduce African American deaths to underrepresented population, the first city to do so many firsts. We wanted to always continue to push forward to make sure that the residents of Los Angeles were the most protected. I looked at a map yesterday of the cumulative per capita deaths in America, and you see in Los Angeles and across the coast here in California numbers that are so much lower than the rest of the country right now. And that really is testament not just to the innovation and the work of the county and the cities of Los Angeles County together, but of you. Your adherence to mask wearing, your adherence to hand washing, your adherence to physical distancing, and so much more. But the three essential pillars of our response have been the following. First is to always follow science-based leadership, where we've always based our action on data and hard facts, not on our feelings. And the best advice of our public health experts, here represented by our public health department of the county, we understood early on what testing could do to get us back on track, to save lives, and to stop the spread. Second has been a spirit of innovation that I was just detailing. A city and a region that's been built and strengthened on innovation, whether it's in aerospace and manufacturing, international trade, or Hollywood. We know that this is a place where generation after generation of dreamers and doers come, and we wanted to apply that right here as well. In August, we organized a dialogue with Duke University, Harvard University, USC, and the Rockefeller Foundation. And we asked a group of mayors as well that I brought together from around the country who was interested in piloting this. What's next, and what will it take to get rapid at-home or at-work testing? And finally, the third part of our response, and perhaps the most important, has been the power of our partnerships, reflected here today. Our entire COVID-19 response has grown out of our collaboration and cooperation between the city and county, medical providers and frontline workers, researchers, policymakers, and we simply couldn't have gotten this far. Safer at home, masks, testing, tracing, and more, without doing this work together. Today, we're seeing all these blocks in action. We're leading as one of the first places in the nation to try out these rapid antigen tests. We are innovating, conducting this study, first with firefighters, who I want to thank for not only stepping up with this test, but they were the ones who have been running our testing together with the volunteers from CORE since the beginning of this, to understand how tests work and where they can do the most good. And we're tapping into partnerships as well with so many people involved. Of course, LA County Department of Public Health the USC School of Public Policy, the Rockefeller Foundation that I mentioned giving the funding to get this off the ground, Curative, our vital partner in evaluating and processing test results, Cellex and Goss, the companies providing the test for the LAFD study, and Cedars-Sinai, which has been an exceptional leader from the beginning of this for supporting the staffing to make this pilot study possible. Side by side, we're committed to this partnership for the clear reasons. First, these tests are cheaper. Excuse me. They're more user-friendly, and they produce much faster results. Cheaper, faster, easy to use. That will help us break the chain of transmission very quickly. You see, this could be the game changer we've been waiting for, but we have to assess that. A day that we could see where we all get tested in our homes and know immediately whether to isolate or quarantine. A day when we can restore enough confidence to send our kids back to classrooms and make sure that parents don't have to be teachers at home. A day when we can look past this pandemic and see our lives begin to be restored, our economies re-strengthen, and have a more equitable city, county, and country. Thank you all for being a part of this, and I really do believe that Los Angeles will continue to lead the way. And with that, let me introduce one of those leaders who's been so critical, Dr. Neeraj Sood, who has come before to our press conferences, but will be a critical part of assessing this and making sure it helps you. Dr. Sood?
Hi, I'm truly honored and excited to be co-leading this partnership with the City of Los Angeles County, and USC. I want to thank Mayor Garcetti, Supervisor Barker, and Chief Terrazzo, and USC President Folt, yes, for, for their leadership. So what, as Mayor Garcetti said, what we are trying to do here is evaluate rapid antigen tests. These tests show a lot of promise because they are cheap or inexpensive. They can give results within a few minutes. And what we're trying to do is understand if these tests can identify individuals who are asymptomatic and infectious so that we can break the chain of transmission. We also want to understand if individuals can, or firefighters here, can test themselves. Self-testing or testing at home can be a game changer. It can dramatically improve access to testing. It can move testing out of hospitals and clinics to workplaces, to classrooms, to our communities. So in the first phase of the study, we will be offering tests which are PCR, antibody, and antigen tests to firefighters who are participating in the study. And we want to learn if these tests can accurately identify individuals who are infectious. In the second phase of the study, we will be taking testing to the drive-through testing sites that the city and county has been running, and also enrolling schools so that we can see if these tests can be part of a strategy for reopening schools. I want to thank Gauss that's providing the antigen test for the study. And these antigen tests are enabled by a mobile app. So it uses an AI-enabled image recognition technology to read the test results. And we are hoping that this AI improves the accuracy of the tests. I also want to thank Rockefeller Foundation for providing the funding for the study. Dr. Anders Berg, who's here from Cedars, that provided the PCR and antibody testing for the study. And Dr. Berg has been a close collaborator. I want to thank Dr. Paul Simon from LA County Public Health, who's also been a close collaborator on this and several other studies. I want to thank my team, Anna Rodriguez, who's a research coordinator, Acacia and Omar, who are MD PhD students from USC and Caltech, as well as Diana and Sonia, who are undergraduate USC students, for working several weekends to make this study happen. Thank you.
You want to introduce him? Here, I'll do it. So next we have an exceptional leader who's really been so amazing with all the research that we've been doing, and I know has been a critical piece of our response throughout the county. He's the head of research at our County Department of Public Health Chief Science Officer. Please welcome Dr. Paul Simon.
Morning, everyone. So as Mayor Garcetti said, I'm with the County Department of Public Health, and what he also said is that partnerships really are so important, and everything that's important in public health that we've achieved historically has come with partnerships, and our current pandemic really demands that partnership. I want to begin by saying, first of all, how proud I am, and our department is to be part of the partnership with USC and the City of Los Angeles on this rapid antigen pilot study. I want to thank Supervisor Barger for her continued leadership on this and so many other issues. I also want to thank Mayor Garcetti, who has been a tremendous partner and leader throughout this pandemic. And I want to thank Dr. Sood, Director of the COVID Initiative at the USC Schaefer Center for Health Policy and Economics. We've actually been working together now for 8 months. It's hard to believe. It seems like an eternity, and it's been a great partnership. And finally, we wouldn't be able to launch this pilot without the supplies and support that were provided by a number of partners, some of whom have already been mentioned: the Department of Health and Human Services, CELEX, Gauss, Cedars-Sinai, the Los Angeles Fire Department, and the Rockefeller Foundation. Since the start of the pandemic, our community has lost more than 7,000 persons to COVID-19. Just yesterday, we hit 7,000. Making it by far the second leading cause of death in Los Angeles County. We grieve with the families of those lost and their loved ones. Luckily, we know what to do to slow the spread and to save lives. Wear cloth face coverings when outside your home, practice physical distancing, wash your hands, quarantine if you've been exposed to a close contact with COVID-19, and very importantly, isolate if you have infection. When used together, each of these tools can give us the best opportunity to slow transmission and prevent serious illness. And with the study we're announcing today, we have an enormous opportunity to evaluate the utility of another important and very promising tool to slow the spread of COVID. If we're able to use the antigen test to rapidly identify residents in Los Angeles County who are infectious and in a cost-effective manner, those who test positive can isolate quickly and prevent inadvertent spread of the virus to their family members, their colleagues, and their friends. But first, we must determine how well these tests perform and the best way to administer them. And that's what we hope to accomplish with this study. I want to thank you all once again for your partnership as we marshal all resources possible to address this devastating pandemic. Thank you. Now I'd like to introduce Chief Terrazas.
Good morning, everyone. Thank you, Dr. Simon. Also, thank you to Mayor Garcetti, Supervisor Barger, Dr. Sood, and everyone from USC who's here today to facilitate this testing. Our LAFD firefighters and paramedics have been on the front line in the fight against COVID-19 from the very start. To date, we have had 205 members test positive for the coronavirus of our nearly 3,800 strong workforce. And we tragically lost firefighter paramedic Jose Perez due to complications from the coronavirus. Jose was just 44 years old and leaves behind a young family. I'm proud to say that in spite of the coronavirus health threat, our firefighters, our men and women of the LAFD, report to their fire station assignments every day to fulfill their mission to protect lives and property for the people of Los Angeles. In order to provide them confidence to them and their families that we're doing everything we can to keep them safe, we have been making available COVID-19 testing since the start of the pandemic. We have also worked closely with the Mayor's office and Dr. Sood to have our firefighters participate in this serology study. We have more than 750 LAFD firefighters signed up to take the test, and more to add to that in the next few days. As part of this study, Dr. Sood will be evaluating the rapid antigen test that at some point in the future may be able to provide first responders, essential workers, and others with a quick notification of their COVID status. The ability to provide rapid notification will have many applications that will assist all of us as we battle through this pandemic. As always, the men and women of the LAFD are on the leading edge of this crisis and are grateful to the Mayor, Supervisor Barger, Dr. Sood and Cedars and many others for their support of this program, getting it initiated and getting it completed. Thank you very much.
No Spanish. Okay. I think that is it. So we'll go ahead and take questions and spray this off. With that, thank you all, and we'll take questions. Thank you.
Thank you. Good morning, Mayor.
Good morning. Yeah, Steve. Good to see you. Thank you.
First of all, can you be a little more specific, and if it's for Dr.
Yeah.
Sood or yourself, on when the rollout actually begins? I mean,
Sure.
is it in process now? Do the tests
Yeah.
are they working now? What's the turnaround time? When you say rapid test,
Sure.
how rapid is it?
So there's two different types of tests that will be using the Selleck-Goss ones as well as the tests that are the Abbott ones that have been talked about at the national level. They can be as fast as 15-minute turnaround time. So that's what we'll be looking at. There's kind of two types of antigen tests, some that need a machine and some that don't, and we're trying to test the ones that won't need a machine. But if you want to add anything else to that?
So we began testing the firefighters last week, and as Mayor Garcetti said that we're using two types of tests. With the firefighters, we are using a self-test where the firefighters can test themselves and get results within 15 minutes. And we confirm the results with the PCR test as well as with an antibody test. In the second phase, we will be using the Abbott test in both schools as well as in a drive-through setting.
How was the sample taken, and how was the test administered?
For the firefighter study, it's a voluntary participation, so all firefighters are eligible.
Logistically, right? Like a swab or...
Oh, I see. The test is administered, you take a nasal swab and you just rotate it in your nose, and there's a little test kit. You put the swab in the test kit, and then you take a picture with a mobile app. And the mobile app is enabled with image recognition technology, and it gives you the results within 15 minutes. So you have to wait 15 minutes after you've inserted the nasal swab in the test kit.
And this question either for you or the mayor, if it does work and if it does prove to be successful, will this roll out citywide, county?
So I think that's a question for the mayor and supervisor.
So the hope of this would be the following. If this is proven to be successful, obviously we'll need millions of these to scale this up. The good news is the state of California just announced, I think 12 million, if I'm not mistaken. Is that right, Amanda? 12.5 million or something of the tests will be coming to California. Will be coming to California, so that we could then make this widespread. But like a vaccine, you can't just take tests and suddenly say, there it is. People need to know the protocols. How often should these be done? In a school, should these be done daily, weekly, for students, for staff? In a work setting, like for firefighters, the same question. So by us being ahead, this pilot is to define all of that. Nationally, we don't have these protocols. So Los Angeles will help write the national protocols, essentially, on this. This is the swab that's used, by the way. It's a nasal swab in this case. So this is something, there's so many pictures of people sticking these up their noses. I'm not going to do it, but, you know, I'll do it, but not on camera. Double dog dare. It's a meme contest whenever people do it. But yeah, this is not one of those ones that goes into your brain. This is the one that goes. I've taken a couple of these before too. That about halfway up, it tickles your nose. But the idea would be, if this is proven successful, that we would be at the front of the line, and that we would have the protocols so that we could tell a school how you open and how you protect everyone, from the staff to the teachers to the students. That would then be stuff we could share with the state and perhaps put us ahead of the curve for others. So this is really about defining those protocols right now. It's already underway, and the plan would be, yes, to have this widespread. To break it down from before, and sorry if I didn't say this, you know, the current PCR tests, it's getting a little bit cheaper, but have traditionally been about $100 to $150 a test. And if you think about a bell curve, there's a long series of days and weeks after you're infectious in which you have virus in you. PCR will catch that, but that's not really that important because you're not infectious. At the beginning, before you're infectious, it will also catch that. But for $5 or $10, you get the main part of the curve and the time when you need to know rapidly. So we also think that this would be a great way not to have a diagnostic test, but if you can go into an area where there's a surge, a community, for instance, we had an outbreak that was in Westlake MacArthur Park. If you can blanket an area with $5, $10 tests, you can very quickly find out who's infectious, and much more quickly than even the 24-hour return time that we have for PCR tests, tell people to isolate, tell people to quarantine, and push that curve down in a much more a quick way than we have today.
How long will this testing phase go on before you realize whether it's success or not?
For the first phase is how many weeks?
So the firefighter study will go on for probably another 2 weeks, and then we're going to move to transition to testing in drive-through setting. And once we figured out that these tests really work, as we said, when they can identify people who are asymptomatic and infectious, then we'll move to stage 2, which is addressing the implementation challenges, building the protocols, making sure we know how to communicate results to parents and children and teachers and so on. So that phase is probably going to last a few months. But the goal here is to do as much as we can as fast as possible, but at the same time be careful and make sure we are evaluating the solutions we want to deploy in the field.
Okay, so the idea then is in a few months we'll find out whether or not this is going to roll out city, state, county.
Yes.
Okay, thank you. The questions coming in now, I've consolidated them because a lot of them
Sure.
are very similar.
Yep.
To Chief Terrazas, can you quickly give us a state of readiness for LA City with the Sandy Hook Open events? And you have engine companies deployed to other fires right now.
Thank you, Steve. Yesterday, while we were at yesterday's press conference around 10 or so, or 11, I got a text from the Orange County Fire Chief Fennessy, that they needed help. So we immediately dispatched 10 engines, 2 strike teams to Orange County. I did check in with one of the strike team leaders this morning, and they're actively doing structure protection. They're doing backfires. The wind is low, it's laying down, so they expect to make good progress today. Now, in terms of the readiness here in the city of Los Angeles, we're constantly ready. We have our brush index matrix. We have pre-deployed firefighters. We've hired additional helicopter pilots, brush patrols. We're monitoring all our cameras that are now in our brush areas so that we can get a head start if we see any smoke on those cameras. So all elements of our brush preparedness are in effect today. Thank you.
Next question, Mayor.
Yep.
Election day is approaching.
Yes.
Given the device.
Are we done with the medical questions? Okay. So if we're good with the medical ones, you guys. And one last thing on the medical stuff, by the way, on the timing. I'm a pretty impatient guy, so I respect the academic need of some months. But I'm hoping if we get some early results, that our national conversation, we may be able to move that more like weeks. Now, not widespread, deployment in weeks, but I think we should be looking at the beginning of the year, if we're getting good results, to see how widespread we can accelerate that. So I think that's the proper academic response to making sure it's crystal clear and perfect, but I think we're going to get results a little bit more quickly than that too.
Have you given a timeline or a deadline?
No, I mean, we'll know some initial results in the first few weeks, right? We'll be able to compare almost instantaneously PCR versus antigen versus the antibody test. So that's something that we'll have some initial data. I'll use that data as a policymaker to have conversations at the national and state level and with fellow mayors in other parts of the country to say, hey, it looks like this is working. Is a school district interested in piloting this now? That's real life implementation. It's not just a pilot. That could be kids back at school if we get that sort of permission. Show one school for a couple months, maybe you get all the schools back.
Thank you,
Okay, you bet. Thanks, guys. Appreciate it.
Question then coming in about
The election, sorry, yeah.
Yes, sir. The question is, with election day next week, given the divisive political climate, there's been concern over security concerns.
Yeah.
What are the plans to ensure public safety and security in Los Angeles, both at polling places
Yeah.
and in the city in general, as the votes are tallied and possible announcement of a presidential race? And
So we're well prepared. I've been meeting every week with the Chief of Police, Michael Moore, and we feel confident. There's a lot of kind of rumors out there that people should close their shops. We're saying absolutely not. We're telling people that they can safely vote. And it is important, it's actually a law, you can't have police officers, nor should you, at a polling place. That's not the kind of country we live in. But we have the ability of all poll workers to call if there's any incidents, any public safety issues. But we've had early voting so far, and there haven't been those sorts of incidents. We're very confident at those centers where people can vote in person right now. We're not seeing that. We see bits and pieces of this around the country, and then everybody thinks there's going to be mobs here. We're not seeing any of that, but we're prepared. So we'll have personnel, we can surge that up if necessary, and we will make sure people's votes are protected. Typical day in LA. Well, they responded right away. They were there protecting lines. I think there's folks who are Monday morning quarterbacks who said, hey, why didn't you have police officers on their own chasing down a group of 3 or 4 people? Those are police decisions. They didn't come from any politicians. That is to protect police officers. You never know, folks are armed. It is always the protocol when it's fast moving that people's lives are more important than property. We do everything we can on property, but there's been never anybody held back on the quickness of response. I don't know. That's run by the city attorney's office because the highest standard is to make sure that's independent. That's not something that I will run. That's not something that I oversee, and it reports to an independently elected official. Again, too, that law firm is separate from the law firm that's defending the city. So that is the highest standard to make sure that we get the truth. That these investigations sometimes can take weeks or months, but you'd have to ask the city attorney.
And then finally, between the alleged corruption within City Council and now the how can you reassure Angelinos that all is well at City Hall?
The system has to work, and I think the highest standard is about making sure when there's incidents that they are investigated and that both parties, accused and accusers, are able to have that due process. That's what's been followed. That's what will be followed. And, dumb people will do dumb things. And I'm not commenting on what happened here. That has to be investigated. But obviously with the corruption, we said, is you have to strengthen the rules. I've been a long time proponent of no donations from anybody who has any business before the city, or you have to recuse yourself from a vote. But people will always find a way around those, and that's why we're pleased to see law enforcement do its job and to let people know a very strong message. Corruption will not be tolerated. Sexual harassment is not tolerated. And you have to say that over and over and over, even if there's dumb people who will violate those rules. Thanks, ma'am. Good to see you. Thanks, everybody.